everyone. So we're here with Michaela Newell. She's a director with the Missouri Pharmacy Association here in Jefferson City. So a week ago, Governor Parson announced a new channel for how to get vaccines out in our state, and that's pharmacies. And you are overseeing that effort.
Yes.
So tell me a little bit more. When did pharmacies begin to distribute the vaccine?
That's a good question. Pharmacies have been vaccinating since the approval of the Pfizer and Moderna vaccines back in December. There have been multiple pharmacy programs in the state of Missouri, including the long-term care pharmacy retail program, which here in Missouri people who mostly participated were CVS and Walgreens. And that program has been completed, and any leftover long-term care facilities, skilled nursing facilities, adult daycares, most independent pharmacies are actually doing those now. But our independent pharmacies a few of them have been receiving vaccine since December, but as of this week, we're going to be starting to get vaccine on a regular basis.
So that's what this new initiative is then, is
Yes.
bringing in the independent pharmacies throughout the state and getting them on board with distributing it.
Yes, and distributing for the regular population, not just people in facilities.
Yeah, and what actually is an independent pharmacy?
Yeah, I like to think of independent pharmacies as your mom and pop local pharmacy. They're going to be the ones who know everybody's names and the names of their dogs, be on the school board and really involved in the community that they're in. So I think that's why it's going to be really awesome to see how different communities are impacted by those independent pharmacies having vaccine on a regular basis, not just 100 here and 100 there.
Yeah. And why is this such an important mechanism for getting out the vaccine?
I think this is a really big step in the process. The governor's office was looking for a solution where we could make vaccine more accessible to individual communities, to homebound seniors, to more vulnerable populations. We started off in Missouri with that mass vaccine clinics, which are really awesome, and they're continuing and have a really great purpose. However, homebound seniors aren't able to attend those mass vaccine clinics. Specific demographics in communities and neighborhoods aren't able to get to those mass clinics. So putting vaccine into your local neighborhood pharmacy allows for an increased access and communication for populations we weren't previously reaching.
Now, are these pharmacies, are they holding their own events at their stores or locations? Are they partnering with churches? Are they going into people's homes? How does it work?
They are doing all in the above. The coolest thing about independent pharmacies is they can do whatever they want, whenever they want. They have no restrictions, and they are creative. So we have pharmacies going to different adult daycares, hosting educational kind of programs at their churches, and then doing a clinic in their church. A lot of pharmacies are going to soup kitchens and homeless shelters. And then just normal walk-ins, like a normal flu clinic. We've been training for this for the past 10 years with flu vaccines, vaccinating entire populations in the fall, preparing for flu season. So they're just doing that same thing, just with COVID vaccine.
And where are we on the vaccine tier? I think we're about to move into a new one, right?
Yeah, we're going to be phase 1, tier 3. So that will include teachers, which most of my pharmacies, a lot of them are using their allocation that was ordered this week for teachers and school districts. And then a lot of extra workers, such as people who might work for Ameren or other employers that are essential.
Now, pharmacies have been able to do this, independent pharmacies have been able to do this really in the past week. So how many vaccines have they distributed in the past week?
So since the governor's office opened up this Missouri State Retail Pharmacy Program, which I was just talking to the CDC yesterday and about this program, and we are one of 2 states in the country that are doing this, and the CDC is really impressed with the governor's plan and how innovative this plan is. So just shout out, I'm so thankful to have the privilege to get to do this. But last week, we pharmacies received about 15% of the state allocation, and that totaled 16,400 doses. This week we placed an order yesterday for around 36,000 doses. So 26,000 of those doses were just allocated based on region, and 10,000 of those were sent to pharmacies in specific pharmacy deserts that were targeted by the governor's office.
It's basically doubled.
Yes, yes, which is so exciting and awesome. Our pharmacies are ready, and they're just so excited to get started.
And are they working with any vaccine in particular, or are they doing all three of them, or?
We only had one pharmacy get Johnson & Johnson technically this week, in last week's order. The rest are all Moderna at this time.
And I know that you were talking a little bit about how innovative this plan is and how Missouri is really unique in that. And I also know that you've been pretty instrumental in overseeing the rollout of this plan and creating it. So tell us a little bit more what your day-to-day is like.
What my day-to-day is like. Oh, wow. Well, before this vaccine rollout and before COVID, I work with the Board of Pharmacy and legislatures to, advocate on behalf of pharmacy. But since COVID has started, it has been enveloped with, since March, making sure our pharmacies are ready and trained and ready to go and make sure that they have the correct protocol and are safe. And since this vaccine rollout, it's 188 pharmacies that we submitted yesterday. So last week was 161, this week was 188. Collecting all of their information and organizing 188 pharmacies. Most of them have different owners.
Yeah.
So it's not just talking to the Walgreens CEO and saying, you get this many doses. So it's been a lot of phone calls, working with the state. Shout out to all the people at Bureau of Immunizations. Those ladies there are working their tails off and don't get recognized all the time. But
how does a pharmacy get added to that? I know you said that you're at 188 now.
Yes.
That's an additional about 20 from
Right.
last week. So how do pharmacies get picked to be in this program?
I am not excluding any pharmacy who wants to be a part of the program. All they have to do is email me. I have a 40-minute webinar they have to watch just to understand how it is going to work. And then I will send them a survey link to collect more information and add them to the program the next week. So this is not any pharmacy that wants to participate is able to.
And what does the oversight process look like? How do you make sure that a pharmacy's not doing something nefarious by giving it to people who aren't eligible or selling it or, things like that?
MPA hosts a lot of webinars, and we have been talking about that and preparing pharmacies for that specific protocol since probably October. And the CDC and the state have very specific regulations on reporting and who gets what. But most pharmacies are doing a questionnaire before they give a vaccine to make sure they're in the appropriate tier.
And how do you see these pharmacies when they're in different areas? They have different communities that they're serving, and generally those communities have different needs. Maybe someone in St. Louis will have a different need than someone in Southwest Missouri. So what are the differences that you're seeing, and how do you kind of balance that?
Yeah, well, I think about my pharmacies in the Boot Heel. They spend a lot of their time educating patients just in their churches and then doing clinics in their churches. Where a pharmacy in St. Louis, I'm thinking about specific pharmacies. They have gone to homeless shelters and done clinics, or organized specific events for populations. So we have a Russian population in St. Louis, and we had a pharmacist that spoke Russian. So they organized an event for that population so that they could receive vaccine and be well educated. So they're just being creative. I think independent pharmacies know their community and know exactly what their community needs because they're there every day. They're on the school board. They're going to church with somebody. So they are able to be creative and innovative and create a service that is perfect for that community.
And are you seeing a difference as well as we're moving through the tiers? Maybe there might be a pharmacy in an area where they've already vaccinated all the people in one tier and they're ready to move on.
That's happening. A lot of the rural areas, until the governor announced tier 3 opening up, we're like, oh, where are the new people?
Yeah.
And when they did that, honestly, they got creative on educating patients. They're like, okay, we know that there's other people still out there that could get the vaccine. How do we educate them about the vaccine and calm their fears that they may have?
So as this program has kind of gotten underway, what's the next step? What do you hope to see, if we sit here in a month from now, what are you hoping to see?
A month from now, I would like a pharmacy in every county to be a part of this program. I think that would be phenomenal.
How many counties are doing it now?
We have identified pharmacies in 84 counties, and yesterday we ordered for pharmacies in 74 different counties. So we are recruiting for 84, but we haven't identified all 114. So, and there's a couple counties I know that don't even have a pharmacy. Not even a Walgreens or a Walmart or CVS.
How do you get the vaccine to a county like that then?
A lot of our rural communities, I'm thinking about a specific pharmacy in Newton County. They were identified as a vaccine desert, and most of the counties around there are specific communities. And those pharmacists care so much that they drive an hour or 2 hours and hold clinics. So that's what pharmacies are doing right now, which I don't think anyone else would do that effort other than an independent pharmacist.
Yeah. I'm sure you would.
So more pharmacies. I also just hope that we just kind of have a dream allocation and we don't have to limit how much vaccine goes, whatever the need is of that pharmacy, we're able to give it.
Yeah, you can take care of it. So it's been about a year now that we've kind of really been dealing with COVID. How has that this past year looked for you personally in the work that you've done? What are some things you learned?
Wow. Well, I'm young, and so I have grown a lot in the past year professionally. I think one thing that I've learned is how different departments in the state government work, and how our state government, the departments just have stepped up. I'm thinking about Director Dixon, who is just like, his job isn't COVID, but he does and helps us, and how everyone is supporting that team in Bureau of Immunizations. So I've just learned a lot more about government and kind of networking and how to work with the government. Personally, we bought a house in the middle of the pandemic. She's a fixer-upper. And so we've been spending most of our time fixing that up, and we've saved a lot of money because we haven't been traveling, so we can put money into the fixer-upper.
That's fun. It's a nice house.
Yeah,
it's a really
thank
house. What has it been like to work with the governor's office on getting this new program rolled out?
Absolutely fantastic. They have been extremely supportive. I remember 2 weeks ago, maybe it was 2 weeks ago, Director Dixon and Robert Nadell gave us a call at MPA and said, "Can you have a plan by Monday?" And it was 4:30 on a Friday. I said, "Absolutely." And they saw our plan and were 100% supportive. And from then on, I'm just to name names because I know none of these people are getting named, but Major Miller has been really supportive, Ted Delacath, Lana, Linnell, and Afra at Bureau of Immunizations. Everyone in the state has just been tremendous, and that is why we have this awesome program, why the CDC saw us as innovative here in Missouri.
And you kind of mentioned this before, some of the independent pharmacies are really doing a lot of work going out in the community and educating people on the vaccine.
Yeah.
What do you tell people who are nervous about it or aren't quite sure if they want to get it? What's your message to them?
You know, as a pharmacist, I don't ever have a message. My usual response is to ask them a question. And so I usually pose the question, why are you truly not getting the vaccine? What is that? What does that mean to you? And really dig deep and see, what that can mean. And then I ask permission if I can share a few facts or share a few thoughts about maybe people around them are immunocompromised, or you have children or babies around you that can't be vaccinated, and caring for those individuals that are around you might be important.
Well, Michaela, I want to thank you so much for being here with us today. You were one of the first people I met when I moved to Jefferson City, and I am just so incredibly in awe of the work that you do. So thank you for all that you do for our state and for all the pharmacies and all the people, and thanks for joining us today.
Thank you for having me, and thanks to Missouri Pharmacy or for Missouri Times for just promoting Missouri Pharmacy Association independent pharmacies.
Anytime.